Dr. Prada, one of the most popular procedures, I think, in our practice and maybe in other areas of the country, what we call the next day lift or the mini facelift. What exactly is that procedure?
Mini facelift procedure is pretty much what it's called. It's essentially a facelift, but it's not as invasive. It's something that can be done in the office, typically under local anesthetic, in a couple of hours. It's a technique that we use to really improve the appearance to the neck and lower third of the face in patients. So people who don't like their jowls, they don't like the laxity of their neck or the loss of a sharp curvature to the neck. Those are patients where we perform a mini facelift.
And who's the candidate for that procedure?
Really anybody who has good skin in terms of there's not a lot of damage from sunlight, patients who have a moderate degree of skin laxity to the lower face, patients who have the jowl formations, patients who don't want to go 5 hours under general anesthetic with a long recovery, higher risks in terms of bleeding and other complications. Those are the patients who are interested in having a procedure that can remove up to 5 to 7 years in terms of the way they look and get them younger looking.
So it sounds like anyone from age 40 to 60 can have this procedure?
Again, there are 40-year-olds who are going to have an advanced degree of aging. I typically try to get patients to be closer to 50 years old if possible to perform any form of facelift procedure, just because these aren't permanent. These are the type of procedures that can drop 7 years off in terms of the way you look, but you're going to continue to age, and you'll have to come back and usually have these kind of retweaks, so to speak. So if we can kind of postpone a little bit, maybe use fillers, fat transfer, other things that we can do in your 40s, I usually try to do that first.
So someone, let's say, that has it in their 50s versus somebody that has it in their 60s, will they have a better result? Is there a certain age you're too far gone not to have it? Is one better than the other?
I don't think there's an age where you're too far gone, but certainly 50s is probably ideal, because in your 50s you're starting to show the classic aging of loss of the sharpness to your neck, excess skin, the jowls, but you usually have very good elasticity of the skin, so you're going to get a really, really nice result. There are patients in their 60s who have very good skin and are good candidates, but there are many of those who I see that I kind of wish they had come in their 50s to really get that result that's really overwhelming.
So how many years can you take away?
I think that kind of depends on the patient. All I do is usually rotate the clock back a little bit. I would love to say that in most cases about 7 years is probably the average. If somebody comes in and they're looking about 55, I would love to get them to look closer to 48.
Great. So 7, 8 years from now, will they have to come back and have something done?
I think there's some things you can do to kind of extend that time period. Fillers such as Juvederm, Restylane are excellent ways to kind of fill in creases. Fat transfer, which is a more permanent technique to fill in creases, can often be done to kind of bridge that gap. But I would say about 7 to 8 years, the patient, I have them come back and we start thinking about just kind of maybe subtly retightening that area to give them a better look.
Okay, let's go back and talk a little bit about the procedure. You did say that it can be done in office. How long is the procedure? And you said they are awake during it, correct?
They're awake. Yeah, we give them oral sedation so the patients feel comfortable. The mini facelift or next day lift usually takes about 2 hours to do. It's about an hour per side. Patients are completely comfortable. They don't feel anything after they're numbed with the local anesthetic. And the nice thing about the procedure is they walk out of here. They walk out of here with a bandage without any drains. We see them back 2 days later, take everything down. In most cases, everybody is starting to really see the difference and see the excitement of why they had it done.
So what is the recovery like?
You're going to get a little bit of swelling, particularly around the ear. A small percentage of patients may get a little bit of bruising in the neck area. But the nice thing about it is since we're doing less of an invasive procedure in terms of undermining or lifting the skin, you don't see nearly the degree of swelling or bruising that you would in a full facelift.
And where exactly is that incision?
The incision is essentially in front of the ear. Okay, it comes in the front of the ear, but we swing it behind what we call the tragus here, so it's pretty well headed, and then goes around your earlobe, back on the back of the ear here, and a little bit in the hairline. It's a little bit shorter than the full facelift incision that goes all the way across almost the top of your scalp. The nice thing about it is over time, that scar is almost virtually invisible to the front of the ear.
Most patients in the Midwest, I think, kind of fear the facelift, even the mini facelift, due to what we do see a lot on the East and the West Coast, in Hollywood. Is this procedure going to give them that tight look where everybody's going to say, you know, you look like movie star X, Y, or Z?
Sure. I would say with the mini facelift, it's actually impossible to almost get that degree of fullness. And the main reason is since we're not undermining as far, we're not distorting your natural facial features nearly as much. We're looking to simply give you a result that softens your face, makes you look more well-rested. That's where the mini facelift is perfect. For the patient who wants to have a really wind-blown look or really the most advanced degree of tightness to their neck and jowls and so forth, we do tend to promote more of the full facelift for those patients. But with the mini facelift in conjunction with some other procedures we do, I think it's almost impossible for them to walk out looking any different.
So obviously there's improvement, or you wouldn't be doing the procedure. So since they don't have that full tight face look, you know, appearance, what will patients notice? What changes will take place?
With the mini facelift, the dramatic improvement is usually to the jowls and to the neck. I mean, that's where the focus should be, because in the 50-plus age group, the neck is usually the last thing to go, or the area that starts to show aging. So if I can improve the neck and improve the jowls, automatically I'm almost bringing that patient into a 40-year-old range. So the key for me is to home in on a very sharp neck angle if possible. That may require a little bit of liposuction to the submental area. It may require me to tighten some of the muscles underneath, which is called a platysmoplasty. But in general, the mini facelift alone can do that. And if we can do that, I think the patient automatically, like I said, can take 7 to 10 years off.
So will coworkers, other people be able to tell they've had something done? What do patients tell you?
Most patients come in because I ask them oftentimes, has anybody said anything? A lot of patients say, no, nobody's really noticed that I've had anything done. But what they do say is something looks different, you look better, you look younger, you look more refreshed. And oftentimes what I'll tell the patient is change your hair a little bit, maybe cut it shorter, straighten it for a period of time. Do something like that. It will fool the patient, co-workers or family, so they know they look better, they know something's been done, but they attribute it more to their hair, not as much to the fact that their neck, jowls, and face looks much better.
So what do patients tell you 6 weeks after surgery? How do they feel?
I think the satisfaction rate for my facial surgery is exceedingly high. It's so rare that I ever have anybody come in and say, oh, I shouldn't have done it, or I don't notice a dramatic improvement. I think the key is to have a good dialogue, good discussion with the patient beforehand to make sure that the next day lift or mini facelift is the proper procedure for them. There are some patients who forego having maybe fat transfer done. We do the procedure, we bring them back later for the fat to fill in some of the hollows to their lower eyelids and their smile lines. By the time you do those kind of procedures together, those patients are really tremendously excited because you were able to address essentially their whole face and not look exceedingly different.